World War II veteran Henry Zanetti is one of the Soldiers Home residents who was moved to the Holyoke Medical Center. His daughter, Mary Klicka, who spent much of last week trying to get answers about her father's care, said learning he would be moved was initially a relief. But now she's grappling with a number of new unknowns. In an update to a story we brought you last week, we spoke with her earlier today.
Well, it seems that there is a lot of illness at the Soldiers Home, and it wasn't clear what would happen if my father tested positive, if he would be in a solitary room. From what I understand, they were putting them in what they called cohort groups. So they would be with others who could be sicker. And if he was positive, but he was handling the virus all right, to have a greater viral load could increase his chances of having a poor outcome. So it was unclear what would happen depending on the results of his test.
But thankfully, you did learn that he did not have COVID-19. He tested negative. And then you also learned that he would be transferred to Holyoke Medical Center, which did happen Friday, I believe. Is that correct?
It is. Everyone was tested Tuesday afternoon by the National Guard, and they told us it would be 3 days to get results. We had a couple calls that told us that it was still pending, and finally on Friday, they did call us Friday afternoon, tell us he was negative and he was going to be shortly transferred to the Holyoke Medical Center.
What was going through your mind those 3 days while you were waiting?
Mostly we were worried about what would happen, whether he was positive or negative. Our understanding was if he was positive, the doctor would speak with us and decide whether we wanted comfort measures or have him transferred to the hospital, which I understood to be kind of a final situation either way. If he was transferred to the hospital, it would mean that he was that ill that he required a ventilator, which at 94 doesn't bode well. And if we decided for comfort measures, it would mean basically hospice care, and we were anticipating the end shortly. So those were not happy thoughts to think about.
Thankfully, you've had happier thoughts to think about in that he was negative and has been transferred to the hospital. Did you get a say in that, though, where he was transferred and when he was transferred?
No, not at all. We got the call, and we were told he would be transferred shortly. My father called me as they were leaving to get in the vans, and that was only about an hour after I was called to say he would be going to the Holyoke Medical Center. So it happened very swiftly. And I'm not sure who informed my dad of his results or what was happening.
And have you spoken to your father since he's gotten there and has been settled?
We have talked to him briefly. There is no phone connection there yet. We did get him a cell phone on Thursday, the day before he left, after a lot of talking back and forth. So he did have his cell phone, but he wasn't really familiar with its use. So we still haven't had a lot of communication. In fact, I didn't find out his room number until yesterday evening.
And do you even know where he is within the hospital? I know you got a room number, but where he's being kept?
We were told yesterday that there was a birthing center at Holyoke Medical Center that was closed, as well as an outpatient cardiac testing unit that was closed, and that all the vets were going to be in those units. I'm not sure how many vets were there. I don't know if they have assigned staff. I know that the doctors from the Soldiers Home are not involved in his care, so they're not familiar with him at all.
So that was actually my next question. You led me right to it. He previously was a resident of the Soldiers Home, receiving care there. They're aware of his medical needs. Do you know now if Holyoke Medical Center has been updated on your father's condition or what he might need for care there?
No. I'm assuming that his records were sent down to them. But with these elderly patients, a lot of their care is knowing the individual and their particulars of what makes it easier to move around, to get dressed, and that takes a while to learn. So I'm sure this is a difficult time for the staff as well as the vets that were transferred.
And for you as a family member, would you have liked to have had a little more notice or even a say in, maybe you didn't want him to go to Holyoke Medical Center, perhaps you would like him at this point to be released to your own care? Have you thought about that at all?
I've thought about having further notice beforehand. I've kind of gotten used to the fact that that's the way they've done things all along, and it has not been a great situation for the families at all. We really had no idea what was going to happen and how he was doing. Everything happened so fast. We didn't know if he was going to be positive or negative, and then as soon as he was negative, he was whisked off. So there were so many possibilities to consider that we didn't really think clearly about any particular one.
And last week, given that there's been a number of changes at the Soldiers Home, the superintendent was relieved of his command, the state took over, that hotline was set up, the email was set up, many of which those decisions we were explained from Health and Human Services were made to increase communication, get better control over the situation. Do you feel like that's happened at this point?
No, not at all. I called the family hotline a couple times to get answers to questions. First, I would get social service personnel, and after that, I would get nurses from the National Guard. General questions they could answer, but anything that pertained to our family situation and my dad, they would answer that they didn't know, they'd have to get back to us. And that never happened. We never got a reply back on any of our questions. And even at this point, when I called this morning to ask about my dad's medical coverage, they really didn't know what would happen from this point on. They pretty much said it was handed off to Holyoke Medical Center, and they would have to be the ones to answer our questions from this point on.
And so for you as a family member, how are you feeling? Are you angry? Are you frustrated? Are you relieved?
A little of all of that, to be honest with you. I'm angry that we weren't involved more, frustrated that all our efforts didn't seem to help at all, and I'm still frustrated that we're not able to communicate more and have more input into the decisions as to his care. We are relieved that he is out of that environment, but the story still goes on.
Yeah, it truly does. For you, if you could speak with someone who's in charge right now, presumably of your father's care at Holyoke Medical Center, what would you want to know?
I'd like to know how much information they got from the Soldiers Home so that I would know if they had the information they need to take, good care of my father and to get to know him, and what the staffing was like there. I know it's difficult everywhere, especially in these times. So pretty much to know what his care is like there.
And at this point, have you heard from anyone at Holyoke Medical Center who's reached out about making a plan for your dad or any of those care measures?
Actually, yesterday evening, a representative from Human Resources called and said they were trying to set up a Zoom meeting for the families and told me to watch my email for an invite to that meeting. However, after checking it off, and I never saw anything show up, so I'm not sure if that meeting happened or if it fell through. I did leave a message for that representative this morning, but I haven't gotten a call back yet. So it sounds like they're attempting to reach out to the families, but they haven't been successful yet.
So hopefully some more answers forthcoming there. Prior to your father being moved, did you hear from anyone at the Soldiers Home about what's the timeline here and technically whose care he's under right now? He is a resident of the Soldiers Home, but now he's at Holyoke Medical Center.
Right. That's what I called the family hotline to ask this morning. And they simply told me that it was pretty much out of their hands. He was under the Holyoke Medical Center doctor's care now, and they would have to answer those questions and decide what his disposition would be as far as discharge. So that's still a big question for us.
Are you concerned that they could reach the conclusion that he needs to be released? And then do you have anywhere that he could go? I mean, you sent him to the Soldiers Home to receive care.
Right. Yes, that would be a big issue. We'd have to find some place that has an opening for him. And my mom passed away a year ago. My father was at another nursing home for a couple months after he broke his shoulder. And our experiences at both led us to believe that the Soldiers Home would be a better situation for him. So it would be a challenge to find something for him that we felt happy with.
So what would you like to see happen moving forward right now, Mary?
Well, my father was getting adjusted to the Soldiers Home after a couple months, and that was a difficult transition. If they could ensure that the Soldiers Home had improved staffing and communication and could ensure that it was a clean, healthy environment, I'd like to see him go back. Other than that, I'm not sure. We'll have to see what happens.